Okay, so this last part, this is where I suppose the piece of resistance is in terms of clearing these peripheral nerve entrapments. As much as we've had a change by treating these two areas here, which we know set up, it's about chasing the restrictions further on down the line. So there's a couple of areas around the elbow where there's tunnels where you'll tend to get these nerve entrapments, if you like, if you even want to call them entrapments, interference. Um, but I'm always guided on where these entrapments are by putting them on the neural stretches, okay, and then I chase it from there. So wherever they feel it is wherever I treat it, and I just sort of treat. I see it, assess, and then I treat, and then I assess, and what I'm looking for is putting them through, increasing their range, and then them really not feeling it anywhere specific. Okay, and then I know I've done my job. So for the median nerve, let's just check you again. I know you're going to be so much better on this median nerve already just with the work we've done, but let's just wind it up anyway and see where you're at. So I'm going to drop it right down now and try and really open it up. Whereabouts are you feeling that? Forearm through this area here.
Top half of the forearm.
Top half of the forearm. So sort of this area here. So that's sort of pronator teres, if you like, which, yep, that'll be jiu-jitsu and rock climbing, I'd say, mate. Or no, actually, maybe a little bit of work. Rock climbing. Is that where you tend to feel it, a lot of it, when you're rock climbing? Medial, inside elbow, forearm?
A lot of the time it's after the fact.
Yeah, right. Okay, so it's after you've done it, then you're sitting there doing this all the time?
A couple of hours later,
yeah.
start to feel it.
Yeah, right. So pronator teres is really important because obviously if we want good supination, we need to have good flexibility through that pronator teres. So if it starts to get hypertonic, then it's going to affect his supination, but also his pronation as well. So he's rock climbing, he's reaching, he's grabbing, he's holding, and he's purchasing off that as well. Mind you, you use your legs a lot, don't you, to save your arms. So we'll save that for another day. So what I'm doing here, I'm opening him up as much as I can into supination. His pronator teres comes down through here, so we know he's been feeling it through there. This is really just to get, like, I mean, you've got pretty good range of movement through your median nerve already, so I'm pretty happy about that. Yep, that's pretty good. So I'm taking him out into supination as I work through that tissue. So you'll probably find I use a lot of passive release techniques. I like to challenge the tissue. But once again, the pressure's all right, isn't it? Shoulders okay? Yep, good. Yep, great. So that's all I need to do. Beautiful. Reassess him again. Lateral flexion. Down. Yeah, look, I mean, I really can't go any further than that, mate. So how's that feeling there now?
Off a little bit.
Yep, good. So that's good. Right, now, now for the radial nerve. Okay, so once again, depress the shoulder down, lock out the elbow, bring him up.
Yeah.
Whereabouts are you feeling that?
Yeah, sort of the forearm.
Forearm? So through there?
Yeah.
Yep, right. Okay, so that's like you're at 90 now, so that's good. That's a good unwind. So you can see what's so important. Putting them through that range, testing them, and then applying the technique to wherever they feel it. So now we know we're going to go radial nerve-wise. We know the nerve runs along the radial bone, so we're going to sort of work along that pathway. So it sort of matches up. Pressure all right? Yep. Through. Beautiful. Once again, all the way up. So I'm not looking specifically for a muscle, it's just wherever he feels it. Lateral flexion. That's pretty good. I'm pretty happy with that. That's good. Great. Whereabouts are you feeling that on that anywhere? Is it bicep now? Right. Bicep there, or bicep there, or is it hard to say? The last one, so sort of there. Okay, so that's where the radial nerve comes around, wraps around the back of the tricep through here. So that's right. We'll do one more sweep on that, but I'm pretty happy with that range, mate. Probably don't need your biceps any bigger, mate. Yep, so along there. Okay, so when did you climb last?
This morning.
Right. When did I see you? Wednesday, Tuesday? No. Oh, I can't remember. Yeah. Did you do jiu-jitsu this week?
Yep, twice.
When? What days?
Monday, Wednesday.
Monday, Wednesday. I didn't see you on Monday. It must have been Tuesday.
Yeah.
Right. How did you go on the Wednesday then?
Yeah, pretty good.
How did it feel?
Yeah, I felt fine.
So you adhered to my advice of just take it easy?
Yeah.
Right, sure. Probably not. Righto, mate. Let's just wind her right back up again. Yeah, that's pretty good. How's that feel there now, mate?
That's pretty good.
Yeah, right. Okay, so I'm pretty happy with that. So let's just recap. So obviously with these, as I mentioned, with these peripheral nerve entrapments, people come in, sort of got shoulder pain, got some tricep, get some bicep, get some forearm, really poorly localized, not sure where it is, usually when they're under load. If they're, a lot of the times the clients will be chasing it, so they'll be rubbing here and then they'll be rubbing there and they'll be rubbing here and then my neck's stiff and all that sort of stuff. So that's when things get confusing for therapists because they're like, oh, okay, so is it a neck? Is it a shoulder? Is it a bicep? Is it elbow? What is it sort of type condition? But that's why these peripheral nerve entrapments go under the radar. And especially for therapists, I can't tell you how many therapists I've treated with peripheral nerve entrapments. In fact, our retreat last year in Bali, I'd say, I reckon there was 4 therapists, they know who they are, had peripheral nerve entrapment. So yeah, it was, yeah. So it's right up there for therapists. And that's primarily because of a lot of the pressure they put through their upper extremity when they're working. So the last part of this situation is, yes, I've done some great work. That's awesome. We've got plateaued out, range of movement's better. It's now about Seb getting in there and actually doing the neurodynamic stretches himself. So we'll run through those in the next video.